Imagine waking up one morning and finding out you no longer have health insurance. Not because you earned too much, not because you no longer qualify, but simply because you couldn't prove you worked enough hours last month. This is the reality millions of Americans could face if Medicaid work requirements take hold nationwide. The government says it's about encouraging work and saving money, but for many families, it could mean losing the only healthcare lifeline they have. Welcome back to Social Security Post, your trusted source for breaking news and updates about Social Security, Medicaid, Medicare, and all the programs that affect your benefits. Today we're tackling a big question. Will Medicaid work requirements cut off millions? Make sure to hit that like button, subscribe to Social Security Post, and if you have any questions, drop them in the comments. I personally reply to as many as I can. Now, let's get started. Medicaid work requirements are proposals that would make certain recipients prove they are working, volunteering, or actively looking for work in order to keep their coverage. On paper, it may sound simple, but in reality, it creates layers of red tape. Recipients might have to report every week or month, often through complicated online systems that are difficult for people with limited internet access, older adults, or those with disabilities. Even a single mistake could mean losing coverage. Supporters argue that these rules encourage self-reliance and reduce government spending. They point out that many Americans already work full-time and see it as unfair for some to receive benefits without meeting similar expectations. But critics counter that Medicaid isn't a handout. It's a health program designed for the most vulnerable, including people working in jobs that don't provide insurance. The real question becomes, is this about helping people or cutting costs by quietly pushing them out of the system? Recent analyses show that millions of Americans could lose coverage under strict work requirements, not because they don't meet the hours, but because they fail to keep up with the paperwork. In one state test, nearly 18,000 people lost coverage within months, many of them already employed but unable to keep up with constant reporting demands. The risk is not just losing health care, it's losing access to medications, emergency care, and preventive treatment that keep people alive. Think about it. A single mother working part-time in retail, trying to juggle childcare and shifts that constantly change, might miss a reporting deadline. Or an older adult with limited computer skills may struggle to upload the right documents. Should those individuals lose coverage when they are already meeting the spirit of the requirement? These stories highlight the difference between policy on paper and the harsh reality in people's lives. In Washington, the fight over Medicaid work requirements has become deeply political. Supporters claim that taxpayers deserve to see accountability and that requiring work will help able-bodied adults transition into full-time jobs with private coverage. They frame it as a matter of fairness. Meanwhile, opponents argue that these policies ignore the realities of low-wage jobs, unstable hours, and the fact that many Medicaid recipients are already working, but without benefits. This debate isn't just about numbers, it's about values. Do we see healthcare as a basic human right, or as a benefit tied to employment status? Critics warn that these rules punish the poor while doing little to improve workforce participation. Yet, with strong political backing in some states and federal interest in reviving these rules, the debate is far from settled. And that leaves millions of Americans stuck in the middle, waiting to see which way the policy winds will blow. We don't have to guess what work requirements will look like. We've seen them before. In 2018, Arkansas became the first state to implement them. Within months, more than 18,000 people lost coverage, most not because they refused to work, but because the reporting system was confusing and inaccessible. Later studies showed no increase in employment, just a rise in the number of uninsured people. Eventually, courts stepped in and blocked the program, ruling that it didn't align with Medicaid's purpose. This wasn't an isolated case. Other states tried similar approaches, only to face lawsuits that struck them down. But despite these rulings, the push for work requirements keeps resurfacing. The question we must ask is, if it failed once, why bring it back? Is it about saving money? or about sending a political message. The lessons from these past battles suggest that the consequences are real, and they don't fall on policymakers. They fall on families. If work requirements return, the groups most likely to be affected are younger adults without disabilities, low-income workers in unstable industries, and caregivers balancing family responsibilities. People working gig jobs, seasonal jobs, or part-time shifts may not always meet the strict hour requirements or may struggle to provide proof on time. These are people working hard, often in jobs that don't offer health insurance, relying on Medicaid to stay healthy enough to keep working. Caregivers, especially women taking care of children or elderly parents, could also be pushed off the program. Even though they are performing unpaid labor that benefits society, it may not count toward work requirements. The irony is that the very populations Medicaid was designed to protect, the working poor, caregivers, and vulnerable adults, could be the ones most harmed. That raises a moral question. Are we helping people climb out of poverty or making it harder for them to survive? Looking ahead, the discussion around Medicaid work requirements is heating up again. Several states are preparing proposals, and new bills in Congress are tying Medicaid funding to stricter eligibility standards. While not all of these plans will succeed, the momentum is clear. Work requirements are likely to return in some form. If they do, the stakes couldn't be higher, with millions at risk of losing coverage. What makes this moment different is the scale. Past experiments were limited to 1 or 2 states, but today's proposals could extend nationally, affecting every Medicaid recipient across the country. That means what happens in Washington over the next year could determine whether millions continue to access basic health care or find themselves left out. For families already living on the edge, the consequences could be devastating. So, will Medicaid work requirements cut off millions? Based on history, the answer leans heavily toward yes, unless changes are made to protect vulnerable groups. This debate is about more than policy. It's about who we are as a country, and whether healthcare should depend on employment status or be guaranteed for those in need. I want to hear your thoughts. Do you believe Medicaid should require work, or should healthcare be a basic right, regardless of employment? Drop your answers in the comments below. I personally reply to as many as I can. And don't forget to like this video, subscribe to Social Security Post, and stay tuned for more updates that could directly impact your benefits and your future. When we look at Medicaid work requirements, the issue goes far beyond politics. It touches the lives of families who depend on this program for survival. If these requirements move forward, millions could lose coverage, not because they don't qualify, but because of complicated rules and red tape. That leaves us with a serious question. Should healthcare be tied to work, or should it remain a lifeline for those who need it most? Share your thoughts in the comments, and I'll make sure to personally respond to as many of you as I can.